Okay, so common knee injuries. Now we're not covering everything, we're covering some of the more common issues, and that's going to be, like we mentioned at the top there, ACL, PCL injuries, and then MCL and LCL. Now the MCL, that's the medial collateral ligament. LCL is the lateral collateral ligament. So these run along the outsides of the knee itself, whereas these ACL, PCL, they run deep inside the knee. Remember looking at that one? You can also have quad or patellar tendon tears that can happen right over the front here. We're going to look at a clip though of an ACL tear because this one's so common, and again it's really hard to visualize, I think. Turn this guy down because I don't need him competing with me. So again, there's the ACL deep inside the knee. If you have forces applied incorrectly, it strains and then can even snap that ligament. Now, there's not a lot of pain sensors in that ligament, so most of the time what people feel is a snap sensation, but no real pain until afterward. What does happen though is the knee itself starts to slop around more because then that ligament's not controlling the motion as well. That's when things start to swell, become more inflamed, and so forth. Now, if you have a snap like that, there's a surgical process that can repair that. Anybody know what that one is? ACL repair, they'll actually drill through the knee from two different directions and a lot of times use a cadaver ligament and anchor it in there so it kind of replaces your own ACL. And it gives you that stability back to the knee so it's not slopping around so much when you try to walk. Again, often not painful at the time that it happens, and it can happen over time. It can happen gradually if the knee is repetitively strained in a certain way and it's not strong enough for the muscles to take that up. It can become more worn, and then eventually one little motion and it'll snap. One little motion. Questions on ACL, PCL? That's a very good question. An X-ray will not show you this. X-rays will show you bone, but since this guy is soft tissue, since it's a ligament, you need an MRI to visualize it. A lot of times though, you can tell if you've got a doc who will just get hands-on with the knee and start moving it around, it goes in directions that it really isn't supposed to. But an MRI is what you really need to be able to see if that is all the way torn or not. Yep. MRI is nice too because it can actually pick up partial tears. So it can tell you if it's starting to go kind of the wrong direction there. So, will it ever heal itself? That is a very good question. We think that partial tears will, in a lot of cases, heal themselves. We know that a complete tear really will not. Once it's torn all the way apart, like you saw in the video, those ends a lot of times separate, and it's just not anywhere where it can really repair itself. So that's a lot of times where you pretty much are stuck with surgery as an option. But an MRI would give you that information to where you could know if that is really the case or not. It's a good question. Thank you. Okay. Next one's meniscus tears. People hear about this one all the time. And so I'm going to show you a video because, again, this is one that's really hard to visualize. Remember, we talked about the meniscus being a cushioning agent between the surfaces of the bones to protect the cartilage. So when it tears, what does that really look like? Again, video is pretty great. So looking inside the knee and looking to the meniscus, you've got one here, you've got one here. What can happen with repetitive motion or a sudden loading, you can actually start to separate part of the meniscus from the rest of it, which creates this extra band of tissue that can sometimes sit in the knee where it doesn't belong. And then that can often lead to locking, where it just won't move all the way, or catching, sometimes snapping. Again, not a lot of pain sensors in these structures. So many times people will have a meniscus tear and they don't notice it until they start doing this with it already torn, and then it gets inflamed, then it gets big and swollen, and then people are going, I don't know what happened, all of a sudden my knee just blew up one day. You know, a couple days before that it might have had, you know, an audible snap or a click even. But that's what a lot of those look like. That specifically is called a bucket handle tear of the meniscus. You can also have a couple other different types of tears where it may tear straight across or may tear the inside of the meniscus. But bucket handle tear is one of the most easily visualized ones, so that's why that's up there. Yes, sir?
What When you have a meniscus tear, does the tear itself actually hurt, or you really don't feel it?
Typically, the tear itself doesn't hurt, but the body's repair process is to drive inflammation there, and that's when it'll start hurting, which is why a lot of times it's sometimes a few hours or a couple of days before you start going, man, my knee is killing me. I don't know what's going on. So you don't really feel so much of that, kind of like an ACL tear. You don't really have many pain sensors there. Now that's not true across the board. Some people have had a meniscus tear and they knew the moment it happened and it hurt immediately. It just depends on if it involves some of those kind of relatively rare pain signals or not. Now, again, MRI, good test for this. X-ray, not so much. X-ray won't show us the meniscus. It'll show us the gap between the bones, but not the actual soft tissue. So MRI is a great tool for this. Other questions on meniscus?
So how is that repaired? Is that self-repair, or is it need to be here, people cutting out meniscus and stuff?
Yes. So that is one I'm going to leave part of the answer to a little bit later because I've got a lot of things to say about that one actually. You can have surgery to remove the damaged piece. And sometimes they'll even shave the residual part of the meniscus to make it smoother so that it operates smoother. But you can't repair it. You can't like stitch it back together and hope that it repairs. So once you've torn it, you know, your options are to cut out the torn bit or even cut out the meniscus entirely. Of course, if you lose that meniscus, you lose a lot of the cushioning also. Okay, fractures. Fractures are zero fun. If you look here, you can see in this is an x-ray. You can see this line right through this part of the knee, kind of the outside part of the knee. That is going to be really painful instantly. There's a lot of pain signals there within the bone. You're going to feel that one immediately. If you can walk on that, you're a superhero because it's usually really, really painful. But what I want you to look at too, because we're just breezing through this fracture slide here, there's also a good bit of arthritis in the inside part of this knee, and we can tell that because this is more white, and we've got some bone spurs that are forming here as well. So it's not always just one thing. Sometimes there's multiple factors with the knees that can lead to pain. I guarantee you this person was having arthritic type pain before they had this fracture. Now they have two problems. Fractures typically heal pretty well, but they're going to put you down for a little while, 6 to 8 weeks typically, before you're back and recovered, assuming that we don't need surgery. This one, they might actually have to surgically stabilize that. It just depends on the fracture, depends on the patient. Anybody had to suffer through one of these? Pretty brutal, they're pretty painful. Okay, a little bit more common conditions like bursitis and tendonitis. This is where you don't have a tear necessarily, but you have the inflammation of some of these connective tissues, the tendons and the bursa, which we talked about the bursa before. This is a bursa, these little guys right here. Those are bursas designed to help everything move smoothly. And the tendons run right over those. So you have a muscular tendon that runs from the bottom of the kneecap right down through here. The bursa cushions it. If you have improper motion in the knee, wearing the wrong shoes, or you got a hip problem, it's making the knee move oddly, what happens is you start to rub the connective tissues against bone and other tissues that are in that area. They get inflamed and then they become painful. And the problem with bursitis and tendonitis is once they get inflamed, they have a hard time coming back down. So in a lot of cases, anti-inflammatory drugs will help temporarily, but in a lot of cases, this condition will kind of persist. Especially if whatever started it keeps going. So, as an example, if you're wearing shoes with really poor arch support and the knee isn't moving correctly, so every time you step down, maybe it's twisting inward too much, you're now rubbing the tendons against the wrong pieces of anatomy, it gets inflamed. As long as you keep wearing those shoes, that's going to keep happening no matter what you do with it. So with tendonitis and bursitis, you've got to have a good look at not only what's going on in the knee, but also around the knee, because there's other factors here. Comments? Tendonitis, bursitis. Blowing right through it. Okay. Baker cyst. Who's heard of Baker cysts? Okay, all right. So Baker cysts are a little bit less common, but I still put them in here because they're, again, kind of difficult to understand. So a cyst is like a fluid-filled bubble, right? And it happens, you can get a sebaceous cyst within the skin. where you get a kind of extra deposit of oil. A Baker's cyst like this, though, is totally different. It's not even quite really what we'd call a true cyst, because it happens when you have knee irritation and inflammation. Let's see if I can get my video to play. There we go. Okay. When you have inflammation in and around the knee, you oftentimes get swelling within that knee joint capsule. Remember we said early on that the whole knee is surrounded by this capsule? Well, as you get irritation there, it has to push that capsule out, but it's only got a couple little spots in the back where it can actually push out. So you end up with this bubble of joint fluid and synovial membrane from the knee pushing out the back. It's painful. The thing is, it can come and go though too. It can be there one day and not be there the next day, because it really depends on the inflammation present in that joint and what you're doing with the knee. So a lot of times if you rest the knee, if you take anti-inflammatory medications, things like that, it lowers that swelling enough that Baker's cyst kind of goes away, but then it can come right back if you're still being active. See this a lot with, in conjunction with tendonitis, bursitis, and arthritis, which is wear and tear. I'll get there in just a second.